Hello, my name is Emily Lopez, and today we will be doing our presentation on against should castration and dehorning be done in food animals. To start off, the history of dehorning. On why did it start? It decreases the risk of injury towards the caretakers. It is also easier to handle and command and transport animals who have been dehorned. There are often times that horns may grow abnormally and may grow back into their eyes and skin. And also dehorned animals such as cows sell for higher price in many auctions. When did it begin? According to research, there is not an exact time that proves when dehorning began, although it has been stated that dehorning has been happening for many years due to the reasons listed above. Dehorning has been a method that has been traditionally used by many farmers around the world. Our first argument would be the higher risk of sickness and injuries that these two cause. To start off, we will be talking about dehorning. Although dehorning may have its pros in the safety of the people transporting and carrying and commanding these animals, it can cause serious effects to the animals after this procedure. These effects depend on what kind of tools are used for this procedure. For example, hot iron disbudding causes behavioral changes during and after 4 hours of the procedure. After this method, it usually leaves damages to the skin around the horn buds. If this procedure is not done correctly, for example, if the iron is not hot enough, the horns can grow back, causing more stress and pain to the animal. Another method is called a chemical disbudding. After this method, behavioral changes are shown and last for about 4 hours. But the difference is that it leaves a deeper wound, which results in a longer healing process. What usually results from the animals being dehorned is decreased weight gain. As for castration, for a lot of cases, the use of toxic chemical hormones, such as lactic acid, is used during the procedure of castration. Although lactic acid is produced naturally in the body, it is much more dangerous when injected. This chemical is used because it helps tense the animal's muscles. Unfortunately, this causes a longer healing process and in most cases has a higher failure rate.
Hi, my name is Desi Navarro, and I'll be presenting the next few slides. So some background information on dehorning methods. There are a few methods, which are caustic paste disbudding, hot iron disbudding, knife dehorning, tube, cup, or spoon dehorning, Barnes or gauger dehorning, keystone or guillotine dehorning, obstacle or embryotomy wire dehorning, and hand saw dehorning. For the castration methods, there are surgical castration, elastrator banding, and Burdizo. Dehorning and castrating meat animals is very difficult as well as painful for the animal. By doing this, it causes stress in the animal, which can also lead to changes in the immune function and increased susceptibility to disease. It decreases feed intake and rumination, inhibition of oxytocin release, and reduced fertility, among others. Current events in castration. Using surgical methods is commonly performed when calves are 3 to 6 weeks of age, often at the same time as other common procedures, such as vaccination and branding. Recent research shows that acute pain increases when calves are branded and castrated simultaneously. Pain medication was effective at reducing signs of acute pain. Chronic pain, swelling, or animal performance did not differ between steers that were castrated only or castrated and branded. For the dehorning part, there are a couple of behavioral changes, which are increase in standing or lying events, tail shaking, head shaking, ear flicking, kicking, scratching, and decrease in feeding and ruminating. Physiological indicators: increase in plasma cortisol, salivary cortisol, heart rate, respiratory rate, and decrease in weight gain. So our second argument is sickness caused by castration. So castration can also create diseases and infections for the cattle, including tetanus, which is a medical condition caused by a toxin that is produced by bacteria, and it affects the nerves, spinal cord, and brain, leading to muscle spasms. Blackleg is another infection, which is non-contagious, and it is an infection that occurs when animals ingest bacterial spores while grazing. Using the common tool to castrate animals is called an elastrator. This procedure has the greatest risk of tetanus and is best when used in animals younger than a month of age. Another disadvantage to this method is the possibility of missing a testicle, resulting in a stag.
My name is Taylor Reeves, and I'll be reading the next couple of sides, which talk about the ethics aspects. So the ethic aspects for dehorning, they look at definitely two indicators, which are the psychological and behavioral indicators, which are used to understand when an animal is distressed and their response to a potentially painful procedure. Some of the psychological issues that you will see involve the inner body actions that the animal has, such as their plasma cortisol levels, which will rise and stay for 30 to 60 minutes, or their catecholaminé, which is their fight or flight response, which is apparent in the first 5 minutes of the procedure, their noradrenaline, which is their norepinephrine. Concentration levels will increase, as well as their adrenaline, which is epinephrine. Concentration levels will increase. The American Veterinary Medical Association proved that these psychological issues are determined by pain indicators because a study that they did with caustic paste and debudding calves as compared to a hot iron when debudding calves, both without anesthetics, showed 1 hour post debudding pain, which just indicates how intense each of the procedures were by how long the pain lasts afterwards, which is recorded by their plasma levels. And these results were found when tested on cattle after various methods of dehorning at various ages. So the outcomes that show these psychological changes can happen in cattle. This helps us find the best and most ethical procedure. These are their internal feelings, and it's one of the indicators that shows us what they're truly experiencing, as well as their behavioral indicators. The behaviors that you see right away in animals can help you understand if the animal is under any distress or pain. Some of the behaviors that you'll see is avoidance behavior, which is observed during dehorning, such as tail wagging, head moving, tripping, or rearing. And some of the post-operative indicators of pain include head rubbing, head shaking, neck extension, ear flicking, and tail flicking. When dehorning an animal, both indicators need to be taken into consideration for the cattle's well-being, and when making the correct decision, studies have shown that the ethical use of anesthetics and how that can affect the cattle's post-procedure. The younger the cattle are, the better the results that you'll have after the procedure. Another ethics aspect is looking at castration. When it comes to animals' pain, no matter the procedure, the animal will feel some sort of pain. The effects of castration that can happen is a weakened feed production, slower growth rate, very stressful situation, and pain could last for hours, maybe even days. It just depends on the procedure. The American Veterinary Medical Association also talked about pain associated with surgical and Burdizzo clamp methods. Both of those are relatively immediate when it comes to pain, whereas pain resulting from elaster band / ring placement is displayed due to the interruption of blood supply. So that one, when using those band and rings, the pain tends to linger because it's slowly cutting off blood supply to that part of the body. The Burdizzo castration also causes a more severe inflammatory response than the band castration. Some of the psychological stresses that the American Veterinary Medical Association talked about was how castration can be the most stressful experience for livestock. Their blood cortisol concentrations have been studied as indicators of psychological stress in the animals, as explained. Same thing for dehorning. Regardless of the means of castration, the cortisol concentrations are increased following the procedure. So no matter what, the animal will show pain after procedure. And there are more ethical methods that can aid the pain process, such as different anesthetics and different pain relievers. Age is a huge factor when it comes to using different procedures on food animals. Results are always best when the animal is younger. When younger, that means less distress for the animals and better healing, less likely for disease or infection. This leads us to our third argument, which is pain is the outcome of both processes. Dehorning, when carried out on calves under 2 months of age, before the horns have attached to the skull. The procedure is termed disbudding. Once those horns have grown to the skull and have infused to the bone, the process is now more painful. Dehorning and disbudding are usually done with no anesthetics or pain relievers. Once the horns have attached, there should be no dehorning allowed because the stress that is caused and what the animals go through can have longing effects. When the animals experience this pain, it can lead to weight loss and psychological issues in their behavior. Same thing for castration. Always the procedure, no matter what is picked, is going to be painful. The most popular form of castration is surgical, which has a higher risk for infections, leaving animals distressed. The elaster rubber bands technique have been associated with increased chronic pain because it is a longing process and should be discouraged. High tension banding systems must be used with appropriate veterinarian supervision or someone training with those situations because it is a longer process than the rest and has to be watched longer. Castration can also be it can create diseases and infections for the cattle, as shown in argument number 2, and those infections can put the animal under.
To conclude our presentation, castration and dehorning in food animals are very alarming procedures and should not be done in food animals. It is a process that is unnecessary because it puts the animals under distress, pain, and can have complications that lead to animals getting sick. No matter the procedure used in both castration and dehorning, even with anesthetics, there's still pain present in blood tests. Different illnesses can affect the health of these animals after both castration and dehorning procedures. There are higher levels of injury risk when performing castration methods and dehorning procedures to animals and the people around them. Thank you.